guys, welcome to our safe space where we talk real, raw, and relevant. We are diving into SRHR. Does that sound serious to you? Don't worry, we are here to break it down for you. And here's how to do it. I am joined by an amazing team and I will let them introduce themselves. Where should we start?
Okay. Hi guys, so my name is Thuku. People call me Ambassador Thuku. My pronouns are they, them. I'm a SRHR activist or advocate. I'm also working for youth health organization as a programs person. And thank you guys. Let's do this.
Hi everyone, my name is Andy Maxwell. I'm an intersex person. I work with Kiwi Rise Network as an executive director, and I'm also a gender diverse advocate, and I'm super excited to have this conversation on the challenges that we face as youths to access SRH in this country. I'm looking forward to having this conversation.
Hello everyone, my name is Malkia John. I call myself a GBV innovator and now a feminist technologist. I'm the founder and executive director of Sauti Salama, which is an organization in Kenya, creating digital innovations around gender-based violence. We have now a platform called Sauti Salama, which you can find on sautisalama.com, where survivors of GBV are able to report and access immediate help. I also work at the intersection of sexual and reproductive health rights and climate. Glad to have this conversation. Welcome on board.
Thank you so much, team. I am so delighted to have you guys here, and thank you so much for honoring our call. So I'm here so that we can talk to the young people, so that they can get to understand the true definition of SRHR as the youth, yeah? So you mentioned about QRise. Yeah. So what do you do at QRise?
At Kiwi Rise, we work with intersex, transgender, non-binary, and lesbian, bisexual, and queer people. We focus more on empowerment and creating awareness on SRH. Yeah.
So you mentioned about intersex, bisexuals, transgenders. Would you likely, any of you, just break it down to people who don't really understand what that is?
Okay, so I'll start with intersex. So an intersex person is someone who was born with sex characteristics that doesn't fit the binary of female or male. Yeah, and also for trans people are people who are, okay, I'll use a trans man. Trans man is someone who was assigned female at birth and then transition medically, but not all trans people are transitioned medically. Yeah. So these are people who are transition. Sorry.
It's okay.
So a trans person is someone who has transitioned from this gender to another gender. Okay. So I was talking about a trans man, someone who was assigned female at birth and then transitioned to a man, whether physically and also medically. Yeah.
All right, that's interesting. Yeah. I hope you guys are able to understand who is a transgender, who is an intersex person. And you mentioned something about gender. Back to you, Thuku. You introduced yourself and you added your initials are they, them, yeah? So would you please explain to people who don't understand what that means?
Okay, those are basically, in simple words, pronouns. So my pronouns are they, them. I'm a non-binary. So I prefer being referred to as they, them, not he or she. That is what I prefer as my pronouns. Yeah. Okay, there are people in the community also, they are not confined by pronouns. They don't want to be referred by any pronouns. So they are just, maybe they want to be referred by their names. Yeah. Yeah, it's like that.
All right, so interesting. What does SRHR mean to you?
For me personally, having worked in the space for close to 5 years, the definition of sexual reproductive health rights has transitioned and also evolved over time. So when I started, it just looked like increased access to these essential sexual and reproductive health rights to women. Now, even after learning and having these amazing people So my definition increased to, equality and equity for all people. So including, transgender persons, intersex person, non-binary persons. So for me, sexual reproductive health rights means, and we talk about SRHR being a right. That's why there's a word right there.
Yeah.
So it's a right for all, and rights do not discriminate. When, regardless of social, class, identity, gender, sexual identity, and all this. So that's SRHR for me. Yes.
That's interesting. That's interesting. And what is SRHR definition to you?
Oh, okay, let's skip.
So to me, actually, let me just start with the sexual reproductive health and rights. Actually, like what Malkia has said, it's about rights, sexual reproductive health and rights. And basically, for me, I dwell so much when it comes to SRH, I dwell so much into the women's side. And for me, women, I mean LBQ women, also intersex women, intersex persons. So I look at SRH in a way that, I feel like women are more like our rights are infringed. Somehow we have been suppressed by systems, and now we are now consolidating our abilities, our energies now to start voicing out our issues as women in the space, wanting more for ourselves. Now, the society and the systems are meant to discriminate us, have been made to discriminate us. So what we do as a SRH activist, now I've come to realize that it is more like it is time for us to like speak about those things. We have now space to speak about it. We have a space like this to speak about SRH. We have so many spaces to speak about. We just need more people to come together, more allies, supporters. It doesn't have to be only women to speak about SRHR, because SRHR is diverse. It involves so many people. It involves cis women, it involves trans women, it involves all queer women. It involves each and everyone. So yeah.
And just also picking up on what Thuku has said, when people ask, is SRHR such an important conversation? And, like, why are we speaking about it? And we don't realize that, without access, for example, if I am a woman, a cis woman in this case, I go to a hospital, I do not get, probably, access to, or I'm discriminated when I'm looking for any of the, it could be maternal, it could be just my contraceptive rights, all these things. It means then, later, a lot of things that are affected, my economic status, justice, there's just a lot of things that are tied to, sexual reproductive health rights that on the surface level, we don't look at it. So people are like, oh, SRHR is just an activist thing, right? But it is not. Like, it goes deeper. It's tied into economic justice. It's tied, tied into a lot of things. Yeah, it's tied into mental health. It's tied into, our freedom as people and a person. Yeah, so that's why we need to have these important conversations all the time.
Yeah. And also, to me, SRHR, what SRHR means to me is access to health first. And for so long, gender diverse persons, especially intersex persons, who've been left out of SRHR conversations. Because, one thing I'll say is because of the challenges we face, also even understanding ourselves. And in Kenya now, we don't have policies that say protect intersex persons when it comes to access to healthcare. Yeah. And when we say SRHR is a right, but some of us, even including me, we face so many challenges to access SRH services. And at least at the moment, I can speak. But we have intersex persons in the, we can say in the village areas, in rural area, who can't even express themselves. And they can't even start discussing about sex. Now, you can imagine now reproductive health is a wide conversation. They don't even understand what is reproductive health. Yeah. So for so long, we have been left behind as intersex persons when it comes to sexual and reproductive health conversation. Yeah.
That's quite unfortunate to hear that intersex are actually having a lot of challenges when it comes to SRHR because they're being left out. Do you feel like there is any measures being made to like rectify the challenges that you guys are going through?
At the moment, we can say in Kenya, yeah, we are somewhere. Yeah. Because in 2022 we got recognition through Children's Act. Intersex children were included in Children's Act because now intersex children, infants, can't go through IGM, intersex genital mutilation, but in reality, it's still happening. Yeah, because yes, in policies things are very beautiful. On papers, but qua ground, let's use this for example, in Kakuma, in an hospital where this parent has given birth to an intersex child, and a nurse there is someone who is ameshika religion, you know, and at the moment religious in Kenya is like not only in Kenya, in the world, it's something else. And now they will start, and also this parent doesn't have information about the child they've given birth to. This nurse or this doctor will tell them, because also this parent is confused. They will say, yeah, we can just do a surgery and correct this thing, because no, now this is a child who was born with ambiguous genitals. So you can imagine uko kama bado ina happen. Even in Nairobi, we still face these challenges because so far hatujapata any data or any doctor who has said there's a parent here who have conceived and this is an they've conceived an intersex child. What can we do here and here and here? There's nothing going on. So far, still, we don't even have the Vileshuri Mesema earlier. We don't have policies that protect intersex persons when it comes to access to sexual and reproductive health.
And also because I had something the other day on Friday. Intersex children grow up to be adults. So the Children Act, you know, recognizes children, you know, it's doing all that. But now after the transition to being adults, what is that catering? There is no catering for SRHR, no rights in that context.
Yes, and also, we have the bill, but also still, but it's a bill that hasn't even reached to the parliament yet. For us, we are still waiting and hoping, this will go through. But as the situation is now in Kenya, we don't even know what to expect as intersex persons because also, let me just mention, the anti-rights movements are growing and growing and it's affecting our livelihoods every single day. So you can imagine waiting for something that you don't even know when it's coming, when it's gonna happen, and we just here, we don't even know. At the moment. And also another thing, even going to the hospital as an intersex adult now, my ID card says Mercy. And my physical appearance says something else. So every time I go to the hospital, because there's this, I have to register to access services or also use my, let's say, SHA. Ikileta hiyo jina, the female name, and then physically this is a different person, it will bring another conversation that will lead to me not accessing the services.
That's true.
So basically you get a lot of discrimination.
A lot. We face discrimination not only in healthcare, in access to healthcare services. Even nimeenda tu ku withdraw pesa, it's my own money kwa M-Pesa, but it bring another issues. Even kwa bank, even accessing to public toilets. I'm just going to the toilet, sijachokoza mtu, someone will just follow me, ona, madam, enda kwa ile washroom ya men. Enda kwa ladies. Because now I'm going to male washroom. When I'm going to the ladies washroom, people are shouting, no, men are not supposed to be here. So I'll have to stay with my, let's say I was going to pee. Itabidi nijikaze until I get home. So what does that mean? By the time nafika home, my bladder, is it okay? No. So sometimes it gets worse to an extent. Nafika home now, maybe you have abdominal issues and already umeweka urine for all that time. It adds your issues.
That's quite unfortunate. And what do you think can be done to make things better for intersex persons?
Okay, I'll start in healthcare. We need to sensitize healthcare providers first, because most healthcare providers don't understand who's an intersex person. Yeah, and also some knows, but wakona ignorance. So first we need policies that protect us, so that when these healthcare providers, let's say, if they decide I've just gone there to get some tests, and then these healthcare providers start calling other nurses to come and see how my genitals looks like, how my body looks like. No, do not use my body as something to learn with. Well, I haven't even given the consent. What can I do now if that happens? Yeah, we need policies that, yes, I can go to the police station, or I can report this healthcare provider somewhere. Yeah, we need accountability. Yeah, we need policies that protect us. We are also human. Yeah, when okay, and also, do we have somewhere where, when people talk about, yes, girls access to healthcare services, and also this word inapotea,
Sijali, you can use Kiswahili, siogope.
Nini, let's say access to sanitary towels, right? People just push for girls, women and girls, but we have intersex persons who are menstruating. Where do they go? We have intersex children who are in schools who are menstruating, and they don't even have sanitary towels that can fit them. Can we start having those conversations?
Inclusive policies. Sure.
You say, because now huyo mtoto ajui, now this is happening, sanitary towel ya kawaida initoshi. Because yes, we have, jinsi yangu has come up with a sanitary towel that looks like a boxer that can fit intersex persons. But are they enough? They are not enough, because they can't get to someone who lives in Kakamega, who is in Kakuma, who is in, let's say, Samburu. Can they get the sanitary towels? They can't. So unapata, when they are menstruating, they'll have to stay at home for those days. Yeah, and then to make the matter worse, you can get, physically they appear as male, but they are menstruating. So what will that lead? Like, itakuwa other kids are making fun of this child. That will lead to them even dropping out of school. So it's a high time we get policies that favors intersex persons. It's a high time we start having these conversations. It's a high time feminists, when they are pushing for the rights of women and girls, they should also push for the rights of intersex persons. Yeah, it's a high time we start talking,
normalizing such conversations. And I hope by using such spaces as the Yoho 254 as well, I think with time probably the word will go out there, and also the intersex will also have a chance to get the policies and help. So back to you, Thuku, as a queer person, what are some of the challenges you go through?
Okay, I speak for for the entire community. One of the challenges, let me start with the simple, that looks simple to the eye. One of the, just going to the toilet, my representation as a masculine person, people like start discriminating me, like in the like me going to the washrooms. Another thing is even in school, at workplaces, we receive a lot of discrimination. It might not be me here, but it might be another person who doesn't even get a job because of already the way they look. They have not even said, but already how they look. Like even in like getting government services, when you find like a trans person going for sexual reproductive health and rights services at a clinic or in a healthcare facility, that is government, that we vote and we pay taxpayers' money, we pay taxes and all that. But when I want to receive services, I want to receive services as a trans person, you'll find that there's a lot of discrimination even from the healthcare providers. You know, like I feel like these healthcare providers, when they are going, they have training, they should be taught on how to have inclusivity education, so that when I go to receive services, or maybe I want to consult on something, they are not going to like start looking at mbona huyu amevaa hivi, mbona nini, mbona amekuja na mtu mwingine nini, this is not good, you know, such conversations, because it is a psychological, it will impact on me and psychologically, you know. We need a lot of, like, as much as we are pushing which on policies and all that, it is just human to just look at someone and just treat them like a human being, because at the end of the day, at the end of 5 years, all of us, they will not come to me as a trans person. They want me to vote for them. They don't care if I'm a trans or an intersex person or a queer person. They'll vote. They'll want my vote at the end of the day. But when it comes to delivering services, when it comes to implementation, when it comes to need their services to us and implementing the ideas, they'll start now discriminating us.
And
communities and all that.
And also to add on that, and it's a good thing you've mentioned the discrimination trans people face, especially trans men who have female reproductive system. You know, this is someone who can also give birth, and it's not supposed to be, because okay, let's say a trans person, a trans man has just, a trans man is pregnant, okay? They are going to a clinic to just receive healthcare services. It's not supposed to bring a conversation, oh, why are you like this? Why are you giving birth? You're a man, you know? Because, no, I'm a human. I have a right to access healthcare services like any other individual. It's not supposed to bring a discussion, and also mbona watu wanaitana kukuja kuniangalia ati anakaa hivi, akona ndevu, akona mimi. No. Because everyone deserve a right to be who they want to be.
I was thinking, and I know a lot of time we sit in these spaces and have conversations as activists and advocates, but we don't speak from the other point of view. Like, I will say it's a right. I mean, no one should question, you know, my autonomy to anything I will do, right? My right, my decision to anything. Now, though we exist in communities of people who have not had this information, I mean, it's even a point of curiosity. So where is that? And I remember, Andy, we were talking about it the other day. What is that middle ground for us? As on this other side, it's activists who want, you know, every person, we know that SRHR is a right. And then there are communities where they do not have this info. They could be curious. Their ignorance is just probably from, you know, people who are just religious. There's just a lot of factors towards even the conversations, or even the curiosity, even the hate that we get from communities, you know, in accessing all these services. So what is that middle ground for us? Is it because as activists we are not doing a lot of community awareness session? Do we need to dismantle the religious structures? What are hospitals not doing enough? I mean, what are nurses, what are service providers in hospitals not doing enough?
Okay, what are they not doing is, okay, creating awareness first. Let's start from, I will say, somewhere like KMTC, okay? If they introduce education where they learn about intersex characteristics, and also, let's say, not only intersex, like bodily autonomy. What is bodily autonomy? Okay? At least that will lead to something, at least, you see, if we get one nurse who is aware in this clinic, they will sensitize other nurses. Okay? That is what we want to see. Yeah, there's trans people. Yeah, like this nurse will start a conversation. Yeah, we are not supposed to be treating these people this way. They're human. They also deserve a right to bodily autonomy. Yeah, they exist, so it's not a big deal. You see, if one person starts talking in that space, yeah, we'll start seeing change. So we need to start seeing at least change in kwanza education institutions. Yes, and at least in Kenya now we have, in CBC they've introduced intersex education, of which it's a good thing because it's okay, as an activist now, yes, I didn't get what I needed while I was growing up, but I'm sure that the children who are in school won't face a lot of challenges that I'm facing now. At least kutakuwa na watoto, kutakuwa na people who are aware that there are intersex persons. Intersex persons exist. Yeah. And at least them understanding intersex persons exist, it will be also easier to accept trans people and non-binary people.
Okay, and I know we're talking about SRHR, but we cannot forget to talk about violence, because the denial of right itself is violence. Sexual right also looks like consent, and if consent is withdrawn, that's sexual assault, and all that. So looking at this conversation, and I mean, because I do work in gender-based violence, and all your stories also have been another form of violence, right? I'm talking myself as a cis woman, and what violence has meant, in the SRHR space. And I was the other day when we were doing the police follow-up on physical assault. I know this is not related to sexual and reproductive health rights, but I mean it comes in different ways. And I think we need to talk about consent and the withdrawal of it, and the systems in Kenya around what is it called, access to help. When it comes, if I've been violated as a person, but also specifically as a woman, and there's a disconnect of these systems. And talking about police, hospitals, and all these chain, the referral pathways for access to help, and access to help, and it's like the denial of right itself. Like rape requires medical and another sector reproductive, health service. It's such a weird cycle. But looking at, the government, and I hate the conversation of what is the government doing, or even the conversation on policies, because every time here we talk about policies, we talk about laws which already exist, but the implementation of it is what is a problem, right? I mean, the Sexual Offences Act has all these things outlined around it, right? It has punishments, all these things are admissible in court, but they forget to say that this whole system exists in a society that has different issues. And these issues would look like a very ignorant police officer. It would look like public institutions and a public hospital charging you to investigate if you've been raped. I mean, and sometimes I'm saying, no one asks for violence. You just didn't. You were not walking and like, oh, okay, come, come beat me, come rape me, come sexually assault or harass me. No one asked for violence. Violence towards women And even sexual violence, to be very specific, is very indignifying. It strips the dignity out of a human. It breaks people. It kills people. And looking at then what are these services? What is the government? Not even government. What's our to survivors of GBV? And looking at also what to do at Sauti Salama. Providing that digital referral pathway, especially for young people, because young people don't want even sometimes to go to a police. Yani, I've had to deal with cases. I'm telling a young person, just go get an OB number, at least to help follow up the case. And they're like, no, Malkia, I just want to heal. I just want to see a therapist, and like I just need to talk to someone. And with the development of AI chatbots, I've seen people literally their therapist is chat GPT. Yeah, like, oh, I'm literally even me. I go and I vent. And I mean, there are all these tools that, tech has brought up. So how are we going to integrate them back to SRHR? I mean, like, especially for young people, because young people now are using more tech tools compared to older people, right? So how do we then join these tech tools and services? Do we provide information on SRHR services to young people through this platform? Do we create like a referral pathway around them getting help when they need it? Is it mental health? Is it survivors of GBV? Yes, that's the conversation I wanted to bring it here.
Yeah, it's quite interesting because right now where we are in terms of the SRHR conversation, the community has made it look like a taboo to talk about sex, to talk about these things. So also the systems makes it difficult for the conversation to be all over. So I think at some point we have to wear the shoes and be the voices of these young people. So it's been an amazing conversation. Unless there's anyone who wants to add on something.
I would like to add on something that Malkia mentioned about rape and access to help, access to justice when you are raped. And when it comes to now, for this I will speak for the whole LGBTIQ community. It's so hard for us when it comes to reporting cases of rape. And also gender-based violence, intimate partners violence. Because every time, so I'll say, I'll use this example. I have a partner, and let's say, okay, I'm not saying I'm violent, because I know this one is a feminist should attack me. So let's say I have a partner and we are having issues at home, and we fought, let's say, and then I report in a police station, and then now when they're reporting, they'll have to use my name, my ID name, of which it's a female name, and my partner is female. So instead of them helping my partner get help, this person, they will now start a conversation of, why are you in a relationship with a woman? Why are you in a relationship with this person? And then now issues will escalate when this person now is a trans woman. You see? Itakuwa story mob to an extent. They won't even end up getting justice. What will she get there? Even trauma. So we need to start having this conversation, because on policies too, the way Malkia said, we still have a long way to go. And also, who do we want to make, who are we looking up on for them to come up, to help us come up with these policies? Do we even have a government that will push these policies or will come up with these policies for us? Do we even have a parliament now that will favor our needs as gender diverse persons? yeah, or as a queer community, yeah, when it comes to access to justice, at a rape, it's even me now as an intersex person, if I go to report that I'm raped, it will bring a lot of issues. Yeah. Kwanza it depends on the person that I'll get to at the OB.
Yeah.
Hapo ndio issue itaanza na tena aite afande John kuja uone huyu anasema amebakwa. In fact, kwanza instead of them helping me, the conversation will be how I look, my physical appearance, my ID, my gender identity. It will bring a lot of conversation, and I won't even.
But I was thinking,
Get help.
Change. I know change is slow, but I love that the young people are now the older people.
Yeah.
Now becoming. Now when we start complaining about police, at some point it will be us who will be the police officers. You know, when you're complaining about very ignorant, healthcare service, we are going to be the ones. So it means then we have a very, very big challenge for us as activists to empower ourselves laterally like this, like horizontally. Like it means if I'm speaking to a young person, I'm interacting with a young person who has the same behavior as that I do not want, then it's my work as an activist to educate them. It means that in the next 20 years, these issues may not be here.
That's true.
Yes, that's true. Now it's up to us to do the work.
So in conclusion, it's all up to us to do to have these conversations normalized and to educate people who have no idea on how to go about these things. Thank you so much, guys, for being here in our channel today. We are so happy, and I hope people back at home have had the conversation and they have learned one or two things.
Thank you.
Thank you.
Thank you so much to our amazing guests for joining us today. We are Youth Health Organization. I hope back at home you have learned one or two things. And thank you so much for watching us up until this point. Don't forget to subscribe, like, leave a comment if you have any question. Until next time, adios.